Okay, hello everyone, and welcome to our Rise of the Robots webinar. As you know, when you registered for this webinar, we're here to discuss our Robotic Surgery Center of Excellence accreditation here at SRC. Being that robotic surgery is one of the fastest growing surgical programs right now and one of our more popular accreditations, we're going to go through some of the most frequently asked questions of this program. And just to get started and introduce us, your hosts, my name is Alex Wakehoff. I work with all hospitals, surgeons, surgical programs who are first investigating this accreditation and trying to find out more. So today I'm your accreditation expert, and then we have Cindy Vanderhoff on as well. She is one of our inspectors, and she is here to be your clinical expert. A little background in case you're not familiar with SRC. We are a nonprofit independent organization. Our main goal, our main focus is patient safety. We have been doing surgical accreditation since 2003, and we are globally recognized for our Center of Excellence accreditations. For all of our Center of Excellence programs, we have a list of 10 requirements that you have to already have in place or have plans to put into place. So a lot of the questions that we'll be discussing today are in relation to some of those specific requirements. Just to explain how this will work, what you're using here, there is a chat option on the right side of your screen right now. So feel free to send a chat just to say hello or let us know you're here. We also will have question and answer option available as well on the right side of your screen. And I'm going to open that up now. So you should see two different options, chat or Q&A. And then we also will hold a couple of polls during this session. And we're going to go ahead and get started here with a poll asking if you have more than one robot at your facility. So you should see the option for the poll on the right side of your screen as well. All of your options will be there. Feel free to ask any questions either in the chat or the Q&A box as we move along, and we will be stopping throughout to address your questions. So I assume that most of you on here know how quickly robotic assisted surgeries are growing year over year. We, again, are seeing that on our side. This accreditation is one of our more popular. And I'm going to go ahead and ask Cindy our first question here, which is, if robotic surgery is growing so rapidly, why do we need an SRC accreditation and what are the benefits?
Well, robotic surgery is the preferred option for many minimally invasive surgeries worldwide. SRC accreditation for robotic surgery promotes the consistent collaboration with a multidisciplinary team, utilizing clinical pathways to provide excellent care to all our patients. Center of Excellence accreditation improves safety and quality of patient care. I have a question for you, Alex. Does anyone else offer robotic surgery accreditation?
So right now, SRC is the only independent and globally recognized organization that offers Center of Excellence in Robotic Surgery accreditation.
What does this program cover? Which procedures qualify for that?
This accreditation is actually what we call a multi-specialty accreditation. So that means that any surgical procedure performed on a robot counts. It doesn't matter which specialty, that any surgical service line, and it also means any brand of robot can count towards this program.
What if my surgeon doesn't have enough volume to meet the requirements at my facility? Can they still participate with the accreditation?
Yes. So for our Center of Excellence program, you do have to have surgeons that will participate with your facility to become accredited. Surgeons who participate can use procedures from any facility to count towards the annual or lifetime volume requirement in order for them to individually become a surgeon of excellence with your Center of Excellence.
That's
So
great.
let's take a break here and take a look at our results from our very first poll. Again, we just were checking in with our audience here to see if you have more than one robot at your facility. And let's see what we have from our group that is viewing right now. It looks like 71% of you have multiple robots, so quite a bit of you do. Some just have one. I do always ask if anyone is just investigating this because they're preparing to get a robot and start building their robotic surgery program from the ground up, which is something that we are happy to help with. So it's good to know that many of you have multiple robots out there. I'm going to go ahead at this time also and throw up another poll for you. One of the requirements for our accreditation is to have multidisciplinary meetings for robotic surgery. So I'm going to go ahead and open up a poll to ask you all if you are currently holding multidisciplinary meetings for your robotic program. And there are a few options of answers just like the last one. So when you get a chance, please go ahead and answer that poll. And we'll continue with some more questions as you do that.
When we're gathering information, can I get case lists from Intuitive?
So most likely Intuitive cannot provide all of the required data elements for case review, and that's usually with a standard engagement with Intuitive. Your representative there, however, likely can provide you with robotic volumes and details on staff and patient education, which are also part of our requirements. So we do recommend still speaking to your Intuitive representative if you have any questions about the requirements.
So there's a requirement for a physician program director. Do we have to create a new position for that in our hospital?
This is obviously these are all common questions, but I will say this is one that we get all the time. The physician program director or co-directors, as you may have co-directors, they must be surgeons who are becoming accredited with your facility to be a surgeon of excellence, like I just mentioned a moment ago. The role is only relative to your center of excellence accreditation. It is not synonymous with medical director. They Whoever takes that role must be primarily responsible for coordinating and attending the multidisciplinary services and systems for robotic surgery. So we do not expect you to create a new budget, an entirely new role for that. It is, again, only in relation to Center of Excellence accreditation.
What if I don't have all the consultative services available on site?
So again, part of our requirements are that you have certain certain consultative services available within certain timeframes. It is okay if you don't match exactly what we have in our program requirements. We just need to know that you have a transfer protocol in place to get those services to a patient should they need it. Again, I just want to remind everyone, feel free to ask questions in the chat or the question and answer boxes on the right side of your screen as we go through here. Um, just making sure you all can see those options and reach out to us if you do have questions. And actually, it looks like we do have a question right now. So let me go ahead and actually show this question here. Do we need a job description for the chair of our robotics committee? And this is someone who is already going through our inspection process. So they are referencing something that we use to collect the information. So we do ask for a job description, but that job description is, again, just relative to what they are doing for your center of excellence. So it would list something like They attend and lead our multidisciplinary meetings. They help with education of staff. They are part of decision making for the robotic program. They have, had input and built our clinical pathways, things like that. And Cindy, I don't know if you have any other tips or suggestions for what the job description might say for that physician program director.
It's really just supportive of the program to keep it, progressing and making sure that you stay on the path of the multidisciplinary point of view.
Okay, perfect. So, as we move along here with some more of our commonly asked questions, Cindy, if the robot was docked and robot assist had to be aborted, does the procedure still count towards the volume requirement?
Yes, it does. In preparing for robotic surgery and preparing the patient, you're having to dock the robot, but you're putting trocars and cameras in place and then docking your robot. So, with doing all of that preparation and part of the procedure to begin with, you still count it as a robotic procedure.
And just to make sure for anyone who is, again, hasn't had a chance to request our robotic surgery program requirements or check them out on our website, as far as the volume requirement, we're discussing a facility has to do at least 200 robotic procedures per year to qualify for this accreditation. So, Cindy, do multidisciplinary meetings have to be robotic specific? How often do multidisciplinary meetings need to be held? And before you answer that, let's go ahead and check on the results of our poll about this question specifically. Go ahead and see what we have from our audience here. Okay. And it looks like everyone who answered, 100%, currently hold robotics specific meetings regularly. So that's great to hear. Cindy, I'll go back to this question. Even though everyone here is holding meetings, they might still wonder if they have to be robotics specific and how often.
So the meetings must at least be inclusive of the robotic surgery program, but as we discussed, it's a multi-specialty service for robotic. So we do require that we have documentation of your last meeting minutes within the last quarter, and that you have the attendance record and the titles of people to just show that it is multidisciplinary. And also, after you've met that requirement, we also look at that you have a schedule for the next 12 months and that you're meeting minimally at least quarterly. So it's just inclusive of, but it can be the multidisciplinary and the type of patients that you're taking care of.
Great. And now requirement number 5 on in our requirements is specific to equipment and instruments. So how does one demonstrate requirement 5?
A facility assessment is done for each program, and the inspector goes out to the facility, and we have you set up an OR with all of your equipment and your instrumentation and your supplies, but we don't have you open them up because we don't want you to incur that cost. We don't have to view robotic surgery. We just need to talk through what you do to prepare for that patient and how you care for that patient. So it's really interview and just showing all that equipment that you have to support that procedure.
Okay, great. And as we continue, I should say, and switch over to our next question, we actually got a question similar to this, and I'm going to bring it up. Any suggestions on robotic director CMEs that are required? we're having a difficult time finding these for the surgeon. The question, this again, we got it here, so it's a great example. We often get questions about if the surgeons who are participating, the surgeons of excellence, need to have robotic specific CMEs. Cindy?
CMEs for each applicant surgeon should be related minimally invasive surgery. It doesn't have to be specific to robotic because there are different specialties that use the robot. So only American Medical Association Physicians Recognition Award Category 1 credits are accumulated. We look at similar credits from other CME accrediting bodies, and or you can have a physician attend either two national or international meetings in that time period for that 3-year period. And those can all
So,
be related
Chris,
just to, sorry.
no, go ahead. I was going to say, Chris, who asked the question, I am not sure if you knew that what Cindy just said was the case. It doesn't have to necessarily be a robotic CME, but it does need to be related to minimally invasive surgery. Hopefully that answers your question, because we do feel that there are a number of options for surgeons to achieve CMEs in surgery, but we do understand that the confusion and the reason we get this question often is that there is perhaps less availability to get robotic specific CMEs. Okay. Cindy, do the covering surgeons all have to be robotic surgeons?
No, they don't. The covering surgeon must have credentials at the facility where they're operating, and they must be able to identify and treat the complications specific to the procedure that is performed and the patient's need. It doesn't have to be that they're going to be doing a robotic procedure, but that they can care for that patient if a complication occurs.
Okay, now there is a requirement for clinical pathways. What are you looking for as our clinical expert? What is it that you're looking for and wanting to see in the clinical pathways that are submitted?
A clinical pathway is we want to see a continuous pathway from when the patient arrives in the physician's office and they're first discussing having this procedure. So they're discussing the preoperative phase, and they follow this patient and the care right through to coming into the hospital, doing the pre-op phase, the OR, the recovery, and then also following them right into the physician office for their postoperative care. So we look for that people have the awareness and they know the signs and the symptoms for complications specific to these surgical procedures. And we look at that each physician, represents their area. If they're a GYN physician or general surgeon or thoracic and they use robotic, that we know that clinical pathway for that particular procedure.
Okay, great. Does the education that's provided to surgical teams and patients need to be robotic specific? Now, I did mention earlier that your intuitive representative can certainly help with providing some robotic specific education, but Cindy, is that all you're looking for?
No, the surgical team must be educated to know how to care for these patients with the procedure that's being performed specifically. They must be able to identify complications specific to that procedure. It doesn't have to be robotic specific, it's related to the patient's procedure. Patients need to also be able to receive information and education regarding their pre-op and their postoperative care and things that they need to be aware of as well.
Okay. We got another question here that I'm going to go ahead and bring up on the screen. Another question that we do get asked a lot, which is how many centers of excellence in robotic surgery are there? So, as of today, we have 126 centers of excellence in robotic surgery That is a global number. So those are not all in the United States. Most of them are right now. Um, I will tell everyone here, if you're not familiar with SRC and all the programs we offer, please check out our website to see all the centers of excellence that are available. But many of our designees who become accredited in robotic surgery also opt to become accredited in their surgical specialties as well. So many of our robotic centers are accredited in things like hernia surgery, colorectal surgery, urology, a lot of the common service lines that are using the robot as well.
So, Alex, I have a question for you. As a center of excellence, am I required to utilize the SRC's Bold outcome database?
So SRC does have a patient outcomes database that is available. It is not required, but use of Bold is strongly encouraged and is also included as part of your accreditation. It offers access to outcomes from all other Bold users as well. If you were to choose not to use Bold, we just require that you track outcomes in a similar qualifying database. And what it comes down to is when we complete our inspections and ask you for case data, which is a part of our requirements, 12 months of data, you have to be able to provide all the data elements we request. If you were using Bold that we offer, we would know you're collecting it and you wouldn't do any extra work. We can run a report directly from Bold for your inspection. If not, then you'll be providing a separate case list to us. And what you'll see on the screen here is actually a couple of samples of reports that we are able to build and run for our users of the Bold database. We can do quite a bit of analytics for you. And again, having the option to see aggregate data, benchmarking data is something that you may not have access to elsewhere. And we did get a question here about Bold. Is there a specific robotic benchmark data utilized with SRC Bold Outcomes database? So right now, we do not necessarily have a robotic benchmark or a robotic version of the database. Our centers of excellence in robotic surgery have the option to use whichever version of our database they would like, and we have a few. We do have some specialty specific versions, which are bariatric surgery, hernia surgery, and minimally invasive gynecology. So if you were using the robot for one of those specialties, you could have the option to use that version of Bold. The most common one that's used is called our minimally invasive surgery database. It is generic. Again, it's not necessarily robotic specific at this time, but it collects just the basic data we need both for our inspection and to be able to do some reporting like what you see on the screen.
So I have one last question for you. I mean, after we acquire the Center of Excellence, what happens next for each facility that acquires that Center of Excellence?
So our designees, SRC designees, have access to CARE. It stands for Communicating Accreditation, Recognizing Excellence. And this is a personalized marketing program. Most of CARE's toolkit and services are complimentary and included in your accreditation participation fee. If you utilize CARE, you will be able to create content to share on social media, including custom graphics, banners, profile images, gifts and templates featuring the accreditation seal. And there are some examples of those here on the slide that you'll see, some of the personalized graphics, brochures, and other things that our CARE team has created. The intent of CARE is to help you achieve whatever goals or benefits you're looking for with this program. So if it is that you want more community awareness, they can work with you on, again, posters, brochures, getting press releases out to your community, putting a billboard up. If it's something that you would like to actually get more physician referrals, that's something else CARE can help with. They can put together a program for you and give you, a plan to follow in order to up your physician referrals. So whatever it is that you're looking for, the CARE team We'll meet with you when you complete your inspection, ask you these questions, and figure out a personalized plan moving forward to make the most out of your accreditation. So we will pause here for a moment just to see if there's any last questions that you have. We really appreciate everyone joining us, and we did want to make sure this was pretty short and sweet for you to give you a quick overview of what our most frequently asked questions are with this program. If you are new, haven't seen our program requirements, please contact us. There are options on our website, and we will send a follow-up email to this webinar as well. So we did get a couple of more questions. Let me go ahead and bring these up here. This question here is who recognizes this accreditation, insurances, and et cetera. So we do not have specific data on which payers do recognize our Center of Excellence accreditation, but our participants have told us that once they present this accreditation to their local payers and the ones that they use the most, they have received better reimbursement. So it is on a case-by-case basis and sort of payer by payer, but we are recognized by insurances. I just don't have a list of which ones specifically. We have another question here. How many people renew their accreditation? What is the process like? So we don't necessarily consider this an accreditation that you renew. In order to maintain your accreditation, you do have to keep up, of course, with paying your annual fees, and then you go through a inspection every 3 years after your initial inspection. Right now, we have a 98.5 retention rate. So that means 98.5% of our participants continue to maintain their accreditation in the ways that I mentioned year over year. I will also mention here, since we just talked a little bit about our care program, that those who do not maintain their accreditation always are ones that also did not use the care program. So we strongly encourage you, should you go through this process, if you already are, once you complete your inspection, please make the most of the care marketing program. It's not just for the hospital, it's for your individual participating surgeons as well. So those surgeons of excellence get access to that individually. The process to maintain accreditation, when we do that inspection every 3 years, it is a little bit different from what you'll go through the first time because we already will know you. We'll know your program and we'll know your team. We really come in and most importantly, we want to see another case list. We want to compare what your outcomes volumes are from 3 years ago to now. And hopefully, if you're using Bold, we've been able to do analytics on the changes in your outcomes and volumes across the course of that time. So most importantly, we're going to sit down and talk with you about what your program has done from the last inspection that we were there and how we can continue to support you in growing that program, whether it be through more help with data, consultative services. If you need help with preparing some in-services for your staff, SRC can help with that. If it's that you haven't made the most of the care program and it's time to really buckle down and do that, that's another thing we'll talk to you about when we do continue to do your maintenance inspections or your compliance inspections. Okay. Well, if there are, oh, we got another one. Let me bring this up here. So from Amy here, we have how long does the entire accreditation process take? That's a really great question, and I will put it back to you. As a participant, as an applicant, a lot of the timeline is in your hands. We do not begin the inspection process until you have first registered for our program, and that just entails signing legal agreements and providing us your information for your hospital and participating surgeons so we can get you set up in our system. Once you make payment on your application fee, we begin the inspection process. And it takes place in two different parts. First is the document submission, which is done electronically. You will be provided with somewhat of a portal to submit the documents to meet 9 out of our 10 requirements, including that case list that we've mentioned a couple of times here. And once that's all been uploaded to our portal, it goes to an inspector, such as Cindy here on the call. She will then sit, go through your cases, request some charts to review as well, and then review all your other documentation. If everything's in order and nothing is missing, then that turnaround process is fairly quick. If the inspector does have to ask you questions, if anything's missing, if any of your documents didn't meet the requirement, they will let you know that. We are not a pass or fail organization, so you would not fail based on missing a document. Your inspector is just going to come to you and let you know what you need to submit or what you need to change if, again, something didn't meet their standards for that specific requirement. And then after that piece, we come in and do the facility assessment, which we also mentioned during this webinar. So that is just a half a day visit with our inspector. They come through and again, check on your equipment, and then they will meet with your team, explain more about how to use accreditation moving forward, and they'll talk to staff. They want to speak to operating room staff, nursing staff to really understand the patient experience. So that's an explanation of the process. How long does it take? Standard time is anywhere between 4 to 8 months. We give you guidelines on how quickly to submit everything that's needed because we don't want it to take longer than that. So I would say that you're not going to see very many people who take more than 11 months to complete the accreditation process initially. I'll give it one more beat here to see if there's any last minute questions. And I think not. So thank you all again for joining us today, and thank you for your questions and participating in our polls here to learn a little more about who was on the call. We will follow up with you all with a recording of this if you'd like to rewatch it or share it with any of your team. And please feel free to contact us at SRC if you have any other questions or would like to talk one-on-one and discuss this process further.
Thank you, everyone.